This is the Plant Powered Challenge 2022, brought to you by Spectrum Health's Lifestyle Medicine team.
Today we are talking about diabetes. More than a third of all Americans, more than 1 billion people worldwide, are either diabetic or pre-diabetic. But even if you have some form of diabetes already, there are ways that you can master it. And in many cases, with many types, you can even reverse it. So today we are here with Dr. Christy Artz, Medical Director for Spectrum Health Lifestyle Medicine, to discuss the New York Times bestseller, Mastering Diabetes, the revolutionary method to reverse insulin resistance permanently. Dr. Artz focuses on living a healthy lifestyle for herself and her family, and she also encourages that same lifestyle for her patients. Motivated by treating patients with acute and chronic illnesses, her work is focused on reimagining how we connect with patients using personalized lifestyle interventions. She is board certified in emergency medicine, a diplomat of the American Board of Lifestyle Medicine, and serves as medical director of lifestyle medicine and is the lead physician of the culinary medicine program at Spectrum Health here in Grand Rapids, Michigan. During our discussion today, Dr. Artz will guide us through some of the highlights of the book and answer many questions commonly asked by patients currently living with diabetes who are looking for a different approach to this condition. We will talk about how insulin works and about what kinds of foods set you up for a healthy blood glucose balance and a long, healthy, and vibrant life. Dr. Artz and her team at the Lifestyle Medicine practice have safely guided many patients through the lifestyle changes necessary to reduce the effects of diabetes and sometimes even put it into a remission. At the end of this discussion, you will learn how you too can work with the Spectrum Health Lifestyle Medicine experts who can help you to master diabetes. Dr. Artz, thank you. If we could first start by talking about this book and why you think it's so beneficial to patients.
Leon, so many of us know someone in our family, our friend group, maybe even our church or community who's living with either prediabetes or diabetes. And we know that there are more and more new cases of diabetes in significantly in greater numbers of our younger American youth. So when we think about diabetes and having it for a lifetime, we know that when people get diabetes at a younger age, they're more likely to develop those complications secondary to diabetes even at an earlier age. So just the fact that we have staggering numbers of people living with this disease really says to me that we need a different approach as to how we prevent and treat this condition. That's why I feel everyone with diabetes or pre-diabetes or has someone in their family or friend group that's dealing with this chronic condition should really read this book, Mastering Diabetes.
All right, let's jump in here and just talk a little bit more about diabetes. It can mean a lot of different things for different folks. There's type 1, even type 1.5, type 2 diabetes that perhaps we hear most about. Can you explain a little bit the differences between those three, how they're similar as well?
And this is covered really nicely in the book too, and I think it's important for people, particularly who are living with diabetes, to understand what type of diabetes they actually have, because that will indicate the type of treatment that they're oftentimes offered through their primary care physician, for example. So type 1 diabetes, previously called juvenile onset diabetes, it's an autoimmune condition that destroys the beta cells in our pancreas. And what our beta cells are there to do in our body is to produce insulin. So this means that our body cannot make insulin, and that's why oftentimes the treatment for type 1 diabetes is to take insulin, either through insulin injection or sometimes now insulin pumps. Different from that is type 2 diabetes, or previously called adult onset at diabetes. And this is a diagnosis that's made when your hemoglobin A1C is above 6.5%. So your body is still able to produce insulin, oftentimes in excess in the earliest times of this condition, in order to try to overcome insulin resistance. So early on in this stage, oral medications are often prescribed, but over time, our beta cells, as they're working really hard, trying to keep up with that insulin resistance, they eventually burn out and they're unable to produce enough insulin. So in the later stages of type 2 diabetes, that's oftentimes when many patients will then go on and need insulin to be prescribed in later, kind of later on in that condition. So type 2 diabetes often occurs in association with other common conditions like hypertension, obesity, high cholesterol, and other metabolic diseases. Contrast that with type 1.5 diabetes, and this is kind of the lesser known condition with diabetes, and it's what's referred to as latent autoimmune diabetes. So it occurs later on in life, typically people over the age of 30, and over time you also see this beta cell destruction. So again, when that happens, our body is not able to produce insulin in adequate amounts, and therefore insulin through injection or a pump is oftentimes needed for this treatment. And then finally, when we're thinking about prediabetes, that's a condition that we should really perk up our ears and listen to when our doctor says that we have markers that indicate that we have prediabetes. That means your body is developing insulin resistance, and this happens before typically someone gets the diagnosis of type 2 diabetes. But in all forms of diabetes, the Mastering Diabetes approach teaches people how to become more insulin sensitive and also teaches people how to increase their carbohydrate to insulin ratio, which we can talk about a bit more.
A lot of times when we think diabetes, type 2 is what comes to mind first. It's the most prevalent form of the disease. But the first thing that many folks think is, okay, if you've got type 2 diabetes, it simply means that you eat too much candy, sugar, and bread and pop. But you're saying it's actually deeper than that.
Right. So again, if we think about the types of diabetes that we just went through, type 2 diabetes is oftentimes a very strongly linked dietary condition. So you're right, oftentimes a lot of our processed foods, sugar-sweetened beverages, things like that will be underlying drivers to this condition, which is also why the Mastering Diabetes approach and the approach of eating more whole plant foods can be so incredibly powerful. But there is a misperception that carbohydrates are the problem with diabetes, when in fact, the nutritional science really points to excess fat in the diet, in particular saturated fat, which causes dysfunction in the insulin receptor. So here's where the science behind what's happening in our body when we develop insulin resistance. So too much or excess fat in the body, particularly saturated fat in our diet, which we oftentimes will find in our animal foods, it creates this problem of worsening insulin resistance. So if you think about insulin is a key to unlocking a door, which allows glucose into the cell. Saturated fat and excess stores of fat in the cells causes the lock to not work properly, and then glucose essentially gets stuck outside of the cell, and that's when we see our blood glucose levels beginning to rise. And it's those high blood glucose levels that eventually will cause damage to other organs throughout the body, like the eyes and the kidney and the heart. And that's what we're really trying to prevent and to reduce that amount of insulin resistance.
Now, many of us know someone who seems healthy, maintains a healthy body weight, that still ends up with type 2 diabetes. And to contrast, we often know those folks that seem to eat whatever they want, all the junk food, and they don't get it. Why is that the case?
There certainly are genetic risks that we need to be aware of. So some of us will have a predisposition in our DNA to developing diabetes. But what we know in terms of our lifestyle-linked conditions, and diabetes is a great example of this, is that only about 20% of our risk of developing that condition is dictated by our genes or our DNA. The other 80% is really driven by our lifestyle factors, and most predominantly by our dietary choices.
So changing diet, of course, is a big part of fighting against this disease if you have it, preventing it if you don't. Where do you recommend that folks start? I mean, cutting out pop and sugar and the high carbs is not always easily done all in one fell swoop.
It's true, and we see a lot of patients that will come to us in our lifestyle medicine practice. Either they've referred themselves because they know that they really want to focus on diet and physical activity and optimizing that to improve their diabetes care or to prevent the onset of diabetes. Or maybe their primary care doctor has referred them in because they also realize that until we take a look at the diet, start to make some changes, really focused changes. We're never going to be able to control this condition, and oftentimes that's what you'll see as patients require more and more medications, additional medications being added, and sometimes, of course, then you'll see insulin doses going up as well. So the first thing that we want to do is, take a book like Mastering Diabetes. And again, I love this approach because there is true power in your hands when you take a book like Mastering Diabetes and start to understand what's happening in the body, the physiology of how you develop diabetes, and then how you can start to take really simple steps. And I always say simple but not easy. We know that making dietary choices and changes are incredibly difficult to do because we have an environment that pushes us toward things like sugar-sweetened beverages, pop and soda and lemonades and energy drinks. I think about all of our children as they do sports and they're told they need to drink energy drinks and Gatorade. And those are the exact type of foods that will drive up our risk for developing things like type 2 diabetes. Also, our very animal food heavy diet that we see typically in the United States. So we want to understand that, number one, carbs are not the problem. Not all carbs are created equal either. And when we think about whole plant foods and this approach that we can take through the Mastering Diabetes approach, we need to think about refined carbs being those added sugars. So again, the sugar-sweetened beverages is a really obvious example, but even then things like breads, crackers, pasta, these are refined carbohydrates. And let's contrast that with our complex carbohydrates that are found in beans and legumes, fruits and vegetables, and whole intact grains. These are complex carbohydrate foods, they're whole foods, and they are truly the key to mastering diabetes. Whole plant foods contain high amounts of fiber and water and plant nutrients, and they're naturally low in calories. So again, when we think about trying to take better control of our health and really master this condition of diabetes, we need to create a calorie deficit and we need more nutrient-dense foods. And immediately that shifts us into this whole plant food approach to eating so that we can improve our insulin sensitivity and begin to make steady progress toward improving this condition of diabetes. Let's take beans as an example. A lot of patients that I'll see in our lifestyle medicine practice, we'll even take it kind of meal by meal. What is it that they typically do on a regular day? From the first calorie that you eat in the morning all the way until the last in the evening, and what does that eating window time frame even look like? And many people don't automatically include beans and legumes in their diet. So I'm talking about things like black beans and kidney beans, pinto beans, garbanzo beans, there's a whole variety. But beans have what we call the second meal effect. And this is why they're particularly powerful when you're trying to address diabetes and manage it better or even put it into remission, is that the fiber content and the nutrient content that we find in beans can give you the second meal effect where nutrients that you eat at lunch from those beans will actually help you to better control your blood sugar, even with foods that you eat at dinner. So they're incredibly powerful and foods that we oftentimes will start to bring into someone's diet as we're making some of these specific dietary changes with patients that we see.
When you think about the typical American diet, is there one thing that you could say, man, if we could get everybody to do X, it would make a huge impact? Is there one place where you could encourage folks to start?
I would say eat more whole plant foods. It's truly that simple. But again, it's not easy because culturally, even in the United States, we're driven towards convenience, a lot of fast food, packaged and processed foods. But if we all said, I'm tomorrow going to take one step toward eating more whole plant foods. That has incredible power. Every meal does truly count, and I think that's a powerful message that helps us to understand how important dietary changes are when we're trying to prevent and reverse chronic diseases, things like diabetes, type 2 diabetes, pre-diabetes, even gestational diabetes, you know, the condition that we can have when you're pregnant and develop diabetes. So eating more whole plant foods would really be the biggest step that I would encourage people to first make. Oftentimes when we eat more whole plant foods, it means that we take away something else that's currently in our diet. So we want to give a positive prescription, and then we want to take something back or lessen our exposure to things like animal foods, packaged and processed foods, and of course, you know, all of those sources of added sugars in our diet that pop up in places like, you know, bread and pasta. We want to eat complex carbohydrates. Carbohydrates are not the problem, but we need to eat the right types of carbohydrate containing foods. So beans and legumes, intact whole grains, and then other fruits and vegetables.
Interesting that the first words of your answer to that question were to eat more of something. I think so many folks think of the antidote to the issues we're talking about is taking things away that you enjoy. But you're talking more really about adding things which will cause you to take away some of those bad habit foods.
Exactly. And, you know, it's a partnership when we're working with individuals to improve their health. And of course, it sounds and feels much better when you can add something rather than just feeling like everything is taken away from you. So it's a combination of doing both. And I think that's when people start to feel the effects of how powerful dietary changes can be. And again, when we take a book like Mastering Diabetes and we apply the knowledge that we learn in that type of book, we can take it meal by meal. And even in the early part of that book, they talk about just starting with breakfast. And I find that this is a really great place for most people to begin, because breakfast is often a time where we're not sharing that meal necessarily with our, you know, other people in our family, or we have more individual control oftentimes over that meal. And so you can begin to make very specific intentional changes, even just with your breakfast, where you're bringing in some of those whole plant foods. And again, that's really the other key, is foods in their whole form, foods as grown, foods that contain high fiber content naturally that we find in our whole plant foods. So again, fruits and vegetables, beans and legumes, whole grains, nuts and seeds. These are the foods that time again, when we study, you know, populations around the world that have low incidence of diabetes and heart disease and dementia and things like that, we find that these populations around the world eat more of these whole plant foods. And that's the approach that we take with patients in the lifestyle medicine practice, and it's a very similar approach that you'll find when you read the book Mastering Diabetes and try to apply what you're learning in this particular book to really master that condition and get better control, and sometimes even put it into remission.
Dr. Artz, a lot of folks tend to think that doctors are perfect at following the advice that they give their patients, and I think it's helpful sometimes to realize that the doctors may have some of the very same struggles that we do. I'm curious, for you, what's in your personal life is the hardest of your advice to follow, and how do you make sure you still do that?
Well, I would say there's a couple things. To begin with, change is a process. So I even reflect back probably about a decade or more now, when I was starting a family of my own, and I know we'll kind of talk about some of this in another session where we talk about raising plant-based kids. But I really needed to look at our lifestyle. My husband and I were both physicians, and we actually didn't learn anything about nutrition in medical school. So that, I think, in and of itself is a really powerful message that I would like to share with people who are listening today, is that if you're doing your research and you're reading this book, Mastering Diabetes, you may be armed with information that your doctor doesn't even have. Now, that's not every doctor. You know, me personally, I spent, again, about a decade to really educate myself to understand the science of optimal nutrition. And I knew I needed to apply it first to myself and to my family in order to be able to then share it with patients that I was treating. So again, it took years to really find and establish patterns that worked well for myself and my family. But once you continue to practice it and you apply this knowledge and you realize the benefits, where you're not fatigued during the day, you rest well, you sleep well, you can recover quickly after exercise, you have the energy to exercise in the first place. All of those day-to-day reminders of why diet and lifestyle factors are so important, I think once you experience it, then you begin to have that internal motivation to stay on the path. So I would share with people, even if they feel like, I have no idea where to start, or I have such a mountain to climb to make these changes, the small initial steps are often the hardest. And then once you start to take those steps, and it can always help to have guidance from a medical physician or a medical team like we have at our lifestyle medicine practice, who can really support you and guide you along the way. But the hard work happens at home. That's where lifestyle habits happen, in our home, in our community, and the places that we work. So building an environment that supports these healthy habits is another critical step. And that's something that I know I commit a lot of time to in my own personal life and for my family. I have 3 children of my own. To make sure that we have whole plant foods available all the time. We have delicious plant-based dinners available, that breakfast, you know, involves a lot of these nutrient-dense foods like berries and greens and, you know, nutrient-dense foods that will promote health all throughout the life cycle. So you got to practice what you preach, you got to apply the knowledge that we learn, and I'm hoping we can share that with everyone who's listening today so that they find maybe an extra little bit of motivation to make a change today to get healthier.
Undoubtedly, folks who are watching this have maybe tried or certainly have heard of a number of different strategies when it comes to controlling blood sugar, controlling diabetes, controlling weight, the keto diet, the Atkins diet, low carb, low fat. What is it about plant-based that makes you feel so strongly about it?
Wow, there's so many places to begin with that. I would say, you know, number one, what I just shared about the effects that you'll feel when you experience optimal nutrition. I think it's so common for individuals to think that these conditions are just going to happen because it happened in my, you know, my parents or my grandparents, and this is just something that I knew I was going to develop as I got older. Or they think it's just an age-related condition. And I would also share with everyone today that most of what we see in terms of chronic disease, and again, diabetes being a great example, is that these are diet-related conditions. And this is not, I'm not saying this in a way that it should feel shameful to anyone or that they've done something wrong, because that's not the case. It's oftentimes, again, our environment really pushes us toward foods that create disease in our life. Our body naturally wants to heal itself, and under the right conditions, and again, the right conditions look like a lot of whole plant foods, daily physical activity, restful sleep, trying to manage stress in effective ways, and having a support system around us as best you can to try to tap into each of those lifestyle behaviors is where health really begins. So diet is a big part of it, but we know the foods that we eat are influenced by, you know, our work setting. They're influenced by, you know, the stores that we're able to access. They're influenced by, you know, the time of day. Can we get to the supermarket once a week? So there's a lot of factors that go into, you know, the dietary pattern that we adopt. But again, we can make very simple initial changes that could begin to transform your health for a lifetime. So again, we talked about carbohydrates not all being equal and trying to bring in more complex carbohydrates, beans and legumes, whole grains, nuts and seeds. Let's also think about all fats not being equal. So when we think about a whole food plant-based diet, we know that starting to bring in more plant-based proteins, again in the form of beans and legumes, and swapping those in place of animal foods that are high in saturated fat. We talked earlier how saturated fat is oftentimes one of the key nutrients that drives chronic disease, and it can drive diabetes. There's large observational studies that we can look to, such as the EPIC study. It followed over 500,000 people over 12 years and found that higher intake of meat, especially processed meats, were associated with increased risk of type 2 diabetes. We've seen similar findings in a study called the Health Professionals Follow-Up Study, and they followed 40,000 men, again for over a decade, and found that increased intake of processed meats, they were 46 times more likely to develop type 2 diabetes. So maybe your place to begin is just deciding today not to eat as much processed meat. So lunch meats, hot dogs, salamis, all those types of meats, they have compounds in them, not just that they're animal products, but they have heme iron, nitrates used to process these meats, and something that sounds scary, advanced glycation end products that are formed in the processing and cooking at high temperature. So when we grill meats, for example, we create these advanced glycation end products that actually drive the onset of diabetes and cardiovascular disease. So we have a lot of power in our home kitchens to prevent and sometimes even reverse chronic disease.
Are there people for whom type 2 diabetes is inevitable, or do you think it's always preventable?
I think there's always an opportunity that we can reverse this condition. And I say that based on the evidence that we have from nutritional science, from lifestyle medicine studies. I also say this in response to what I've seen occur with patients in our own medical practice. There are strong studies, particularly that we've seen in the last 5 years or so, that the initial approach to someone who has received the diagnosis of type 2 diabetes, the first approach should be an attempt at remission. And I'm saying that that is a really strong statement that I would like to make today, and I would like people to think about that when they are for the first time getting that diagnosis of prediabetes or diabetes, that to find, either work with your personal, primary care physician, or find a physician who can help you approach this condition to put it in remission. It is possible in the vast majority of patients to actually, within particularly the first 2 to 5 years of diagnosis, to put this condition into remission. And what we mean by remission is normalized diabetes markers, so that hemoglobin A1C being in a normal range for 12 months off all medications. That should be the goal that we can empower patients to work towards, instead of people feeling like this is a diagnosis where they're going to have to take medication for a lifetime. That is not the case in the vast majority of people.
Let's talk a little bit about a few of these what many people call fad diets, fad concepts. Let's start with low carb and keto diets. We hear on the internet and elsewhere folks who have had success from that. What are your thoughts on that?
These dietary patterns have been around for a long time, and in the short term, many people do experience really significant benefits from making changes in their diet if they adopt a low carb approach, as an example. One of the initial things that they might do when they adopt that approach is remove sugar-sweetened beverages or stop eating as much processed food or fast food. And those are amazing, really intentional, powerful changes that people make. And so in the short term, they'll often realize benefits, and that should be celebrated. But ultimately in the long term, when we look at long-term studies, those have demonstrated that there's always a higher risk of all-cause mortality associated with higher intake of animal foods. So most times, again, in the United States, when someone applies a low-carb way of eating to their lifestyle, they usually include a lot of animal foods. So think of animal meats and cheese and dairy, you know, even bacon will show up on the plate oftentimes. And while you may see some early short-term benefits, and people with diabetes will even say, hey, my A1C got better, my fasting glucose results got better, that's a very short-term change. But underlying all of that, we still have the insulin resistance that is driving this condition. So when they are exposed to carbohydrate-containing foods like fruit, for example, they'll find that their blood sugar spikes up. So they'll say, I can't eat fruit because fruit is making my diabetes worse. When in fact, it's oftentimes that high-fat, high-animal protein pattern of eating, which is causing, like we mentioned earlier, the problem in the insulin receptor, which is not allowing glucose into the cell, and it's making us essentially insulin resistant. So what we want to do is, instead of following that low-carb dietary approach, we're trying to get our body more sensitized to insulin so that we can have a better carbohydrate to insulin ratio. And when people are following typically a low-carb diet, the carb to insulin ratio is very low, and people experience, like I said, these spikes in blood glucose when they eat carbohydrate-containing foods. So when we start to shift the diet, start to eat these high-fiber, micronutrient-packed whole plant foods, then we can begin to reverse that insulin resistance. They begin to tolerate foods that they typically really enjoy. Most people want to be able to eat an apple or enjoy berries in the summertime or eat these foods that they find really delicious. So insulin sensitivity really is the key to, again, this approach of mastering diabetes and being able to come down on medication needs and maybe even come off of those medications in time.
Another concept I hear a lot about is fasting, intermittent fasting, skipping meals. Does that help?
Fasting is an incredibly powerful tool that we implement many times with patients in our lifestyle medicine practice. It's well supported in the science. It is in our evolutionary biology as humans, we're very well equipped to tolerate fasting and to use fasting as a way to prevent and reduce disease. So in particular with diabetes, it can be a very powerful approach whether we apply intermittent fasting, even up to 24 hours, and you'll read about that in the Mastering Diabetes book, is how to apply safely intermittent fasting so that you can understand what your medication needs might be now, and as you get better, how to safely begin with your physician to lower some of those medication needs. We'll even advise patients to do a more prolonged fast, like a 5-day fast every month for several months in a row, so that we can help them reduce weight, help them improve their insulin sensitivity, and that is an incredibly powerful therapy that we apply to help patients get better and, again, to really master this diagnosis of diabetes.
I know no doctor has a 100% success rate in getting their patients to the desired outcome, but it seems like most doctors have a story they're particularly proud of. Could you share with us a story of a patient where you really felt like implementing this advice made a difference and something that might inspire folks watching today?
There's a really lovely patient that I just get a big smile on my face when I see that she's on my schedule to be seen at our lifestyle medicine practice. And she actually discovered this book, Mastering Diabetes, on her own. She had seen on the internet the authors were giving a talk, and she herself was living with diabetes and was a very active lady and, you know, doing a lot of really great things to support her health, but still finding that insulin needs were high. And she discovered that at our lifestyle medicine practice that we were well equipped with a lot of nutrition knowledge, and so came to see me as a patient. And I've now been seeing her for several months. And we've seen phenomenal results in terms of what her insulin needs are. They've come down significantly by over 50%. She is managing this condition. She feels really empowered, I think, is the other great thing. When I see her, she just lights up. She feels like she knows how to manage and master her diabetes so that she won't have the complications that we oftentimes see patients with diabetes develop, whether that's the most common cause of death in diabetes is cardiovascular disease or heart attack, and stroke is common. So when you can figure out ways and apply a method like the Mastering Diabetes approach to improving and just managing this condition more effectively rather than adding more medications, really finding the lifestyle changes, in particular, the dietary changes, eating more whole plant foods, daily physical activity, applying fasting, all of this together, and that's the approach that this particular patient has taken. She's thriving, and I expect that there's going to be great things, more to come with her, and I'm just really excited about the success that she's achieved.
A lot of folks do need the help of someone like you to get into this. Can you talk a little bit about resources and how folks might be able to get help with the Mastering Diabetes approach?
I hope that for those who are listening today, if you're in the state of Michigan, that if you are looking for a different approach to treating your diabetes, that you'll give us a call, that you'll follow the link that we'll provide later to how you can set up an appointment with one of our lifestyle medicine physicians. We have 3 lifestyle certified physicians on our team. We have a fabulous registered dietitian. We have chefs on our team. So we take a very lifestyle focused approach and empower you with those knowledge and skills that you'll need to not only prevent and maybe put into remission diabetes, but other conditions like we mentioned, whether that's cardiovascular disease or patients who are trying to prevent dementia later in life, or maybe chronic kidney disease, autoimmune problems. These are conditions that our team is well equipped to help you with and guide you through how you can truly get better. But we have a couple upcoming visits, in particular for listeners who have a diagnosis of prediabetes or diabetes who want to work closely with our team. We would love for you to reach out by one of the methods that we'll supply to you in order to contact our team and come see us as a patient in our lifestyle medicine practice.
What can you say that you'd hope would inspire someone who maybe hears even the advice we've given today and still thinks that they can't do it?
I would say there is power in making small changes. You're here as a participant of our Plant Powered Challenge. You clearly have curiosity to learn how to better manage your condition. If you have diabetes, or maybe it's something that runs in your family, you have the power to make these changes, that there is good evidence to support lifestyle changes, eating more whole plant foods, and we're here to help. And I'd say tune into more sessions during our Plant Powered Challenge. You're just going to get armed with more knowledge, more skills, more tools to be healthier for a lifetime.
All right, Dr. Artz, thank you so much.